those that certain foods will blow up a joint. So you're saying if you have to avoid certain foods because of your health conditions, sometimes that increases your health dollars, right? Anything else you found that you're spending a lot of health dollars on? Yes? Transportation. Specialists. So we're spending more money when we go to specialists, right? Or is it the same as a PCP? Same copay?
No.
It's usually more. Medication. Medications. We talked about medications costing us money. And that's great if you don't pay for medications. But sometimes you may, especially if it's non-generic. So I wanted to just spend a brief time today explaining your health dollars. We take it for granted sometimes, especially if you're a senior and you get Medicare. Medicare often given when you're 65 and older. You get health insurance called Medicare, and if you take that Medicare and you put it in what is called an HMO, oftentimes those HMOs will advertise $0, so you're not spending any health dollars if you go to a Medicare, emphasis on care, HMO, right? But be very clear. You may not pay out of pocket anything if you're an HMO, but I've had some of my patients who are in an HMO and they're spending health dollars. What do you think they're spending it on? Anybody had to go fix their teeth? Where's this? Dental. So I want to show you that even if you're in a Medicare HMO, even if you have Medicaid based on your income, even if you have a PPO, pay to play, you must think about your healthcare dollars. So how do I think about my healthcare dollars? First of all, don't be fooled that it costs nothing.
It costs something.
Everything costs something, especially in America. Anybody know the term copay? Copay. And if you have family members, this is like a bad word. They come into my office and it's a miracle. I have a copay? Oh, girlfriend, did you look at your card? Most people, if you look at your card, it will say what your copay is. And copay means what you're partnering to pay for. And then my friend just always tells me, I told them that it's no longer $15. Their copay has gone to $30. What you mean? My card says it's $15. Well, you have the old card. That 2022 doesn't count anymore. For 23, you're paying $30. So be aware of what your copay is going to be when you go to see a doctor. What you have to pay outside of what the insurance pays every time you go to a doctor's office. Well, what if you don't see the doctor? Well, I didn't see the doctor. I only saw the nurse. Oh, I didn't even see the nurse. I just saw the medical assistant who drew my blood. Do you have to pay a copay?
Yeah.
Oh, say the word. Say it.
Once you walk through that office, it don't matter.
Once you step foot in that office, the meter starts going. It's for your office visit, regardless of what you do in that office visit. Okay? That's for your office visit. Whether you see a nurse, a PA, the medical assistant, the doctor and the nurse, or the doctor and the MA, you're paying a copay. Okay? For many HMOs, they'll say $0. But some people still have to pay. There's another word that a lot of people don't know that is part of their health dollars. Anybody ever heard of the word deductible?
Yeah.
heard deductible?
Yes.
All right. How do you feel about deductibles? Anybody know what a deductible is? Deductible. You ever heard it? Deductible? The insurance company will pay $800, and I will have to pay $200. 80%, 20%. Look at the fine writing to see if you have a co-insurance. Okay? Real important. This is a new thing that's come out about the last 5 years or so. People always know about the copay. You pay that every time you walk in the office. Deductible, you gotta pay for the whole year. But this co-insurance, the co-insurance is sneaky. And that usually shows up like if you go in the hospital. Because every day you're in the hospital, it may cost like $2,000. And then you go home, a month later you get a bill. You were there for 5 days, you had a $10,000 bill, but you already met your deductible, and you said, why do I have a bill for $2,000? Co-insurance. Co-insurance. So check out your policies, check out your plans, and know these things. Real important to know these things. Now, I did this before in another class. Back to the money. You're paying for syringes. When you go looking for a health plan, you gotta think about the things you use a lot. So if you're diabetic and you know you use strips, you know you use needles, insulin, syringes, ask the question, do you cover it? How much is my deductible or copay? What do I have to pay if you don't pay 100% of my syringes? And even in HMOs, there's certain things that are not paid. Anybody knows anything that they have that they won't pay for? Yes.
A lot of the outside doctors, they won't pay for it if it's not my primary.
Oh, key word.
DeSantis, he made a new law.
Uh-huh.
Certain things they're not covering no more, like transportation. I'm definitely sure about that. Transportation, outside doctors.
See this? Out of network. Out of network. Does anybody know what a network is? Think of it like this. A network is like a basketball team. There are a lot of basketball teams. On the basketball team are a bunch of players. The players are the network. If you on the Heat team and you got a deep bench of 10 players, you can't go over to, Chicago team and go sit on their bench and play. You cannot. You're going to have to pay. So if your Blue Cross Blue Shield has a bunch of doctors that they have contracts with, and you decide to go to a doctor they don't have a contract with, who's going to pay?
You gonna pay. You're
gonna pay. Know your contracted doctors. The first question you need to ask when a doctor sends you to another doctor. Don't ask your doctor, they don't know. You pick up the phone and you ask them, do you take my insurance?
Okay, I have a question.
Yes.
Say hypothetically, my doctor is sending me to another doctor.
Right.
Why would I have to call them as opposed, my doctor should have a directory where he can send me. So why would I have to call the other doctor to see if they take my insurance?
Good question. If my doctor, I'm a PCP, and I'm sending you to go see the cardiologist.
Right.
Now, why should I ask the cardiologist, do you take my insurance?
Right.
One reason. In fact, best thing. You got Winn-Dixie and you got Publix. You go to Winn-Dixie, and I've been looking for chocolate creamer. And I asked the guy at Winn-Dixie, you got chocolate creamer? And he says, no, we hardly hardly ever have chocolate creamer, but maybe Publix has it. Guess what? If I go with Publix, they know what's on their shelf. Over here at Winn-Dixie, they just guessing that Publix has it on their shelf. Same thing with your doctors. Yes, they may have a directory, but those directories change every day. That's why they're no longer on pieces of paper. You got to go online and look in the directory. A doctor will send you, like myself, a PCP with a doctor I think is on your plan. Like I think Publix has chocolate creamers. I don't know. I'm hoping. So it's your health, your dollars. You pick up that phone and you call. But it doesn't just stop with that. And I'm telling you this, yes.
I'm sorry. I just, cause I do a lot of the class with you. I just noticed that the patients expect the doctor to do administrative, secretary, receptionist work. Keeping track of a directory for your convenience, that's the insurance. They keep that. The doctor's job is to make sure they connect you where you need to go to take care of your health. They can't sit there all day trying to update a list. You know what I'm saying? Just a different perspective to understand, you know?
Here's my problem.
Yes, ma'am.
I'm with United Healthcare. They don't have a date, I know. But
Okay.
if they did, I'd be over there trying to find out more information.
Call us.
So listen to what I'm telling you.
Yes, my love.
I find out you get more service at the office than in the phone call.
True.
Because they're going to refer you to somebody who ain't going to know what you talk about.
Right. But here's the thing. You
But
just
see,
made
this is why, because I knew you was coming, this is why I brought this.
Yes.
Here are 2 prescriptions.
Right.
One is stacked,
Uh-huh.
that's for whole body skin.
Right.
And the other one is for the GI doctor.
Okay.
DeSantis blocked this,
One's for GI.
but I need it because I went into the emergency room with GI problems,
Mm-hmm.
and he blocked it. So what do I do?
Okay. Hold that
Because
thought.
my doctor,
She said, hold that call.
Okay. Okay. So you give me 2 questions. So, first thing you have to know, are they in network? Right? Now, nothing matters unless it's medically necessary. Necessary means you will die if you do not get this treatment. I would like I have a lot of people, Dr. Powell, can you just check my blood type? I'd like to know what my blood type is. Unless you have anemia and you may one day need a transfusion to save your life, I can, in all honesty, just check your blood type because you would like to know. Now, good point. She was referred by a doctor from the emergency room, and since she's sharing, I'm not going out of HIPAA, but she's shared, to see a gastroenterologist, a stomach specialist, and to have a stat body scan. Well, the first thing I'm going to tell you, there's an error here. A body scan is never stat. And I'm telling you why. In order to do a body scan, it has to meet medical necessity, but there's a whole lot of preparation that goes into a body scan. Stat would be you walk in and need an x-ray and they're wheeling you in immediately and it's getting done. Gastroenterologists are backed up at least 4 to 6 weeks on the short side. Some of them are out 3 weeks. Don't even try cardiology right now. So that is a time where you may need your provider to pick up the phone, not ask if they take the insurance, but say, can you urgently get this patient into your office because I believe we have an emergency here. Urgency, not emergency. Emergency, you go to the hospital. Urgency, you pick up the phone. Blood, guts, and dying, don't stop, don't go, just call the ambulance and go. But if it's an urgency, your doctor will pick up the phone and should, like I will, and call the doctor's office. Can you see them? Can you squeeze them in? Now, if you're being squeezed in, don't walk up in that office and say, my doctor called and they said I can come. If you're being squeezed in, you gotta be patient, right? Now, I'm not clear about the rules and regulations that DeSantis has changed, but if you have a medical necessity while you're being sent to a GI in order to get a PET scan, your primary care can write a letter of medical necessity that will go under evaluation by United Healthcare to see whether it meets medical necessity, see the doctor that is in network to get the test done. So it's not the end. They may have denied it, but you can get override. Learn that word, override. Every no is not a complete no, right? Usually they will give an alternative. They may want you to see this doctor at this hospital, and your insurance may say, because of health dollars, we don't work with, don't want to name the name, but there's some hospitals, some insurance don't play with because they are expensive. And they have contracted with other hospitals that they'll say, no, you can't go to X hospital, but you can't go to Y to get this stuff done. Or you can go to this doctor, but not that doctor. And that's why you call. You call to make sure it's a network, and you look at the directory. Or you call your insurance company and ask them directly, is this provider in network? Because I'm not paying the copay. Hire what they call an out-of-network copay. Give you a real true example. And my son, forgive me, but you know you're always fodder for all my work. So my son is young. He doesn't know a lot about healthcare and health dollars. He had an appointment to see an orthodontist. That's the one that pulls out the molars. And I said, baby, please, please, please call them and find out if they're network. Guess what? He called. Young, wonderful man. And they told him, what? Yeah, we're in network. He now goes to his appointment, but before he goes to his appointment, I said to him, when you get to that front desk, ask them again, are you in network? Why do you think I told him ask again?
No, for the money they finna charge.
For money, but here's what we have to stop assuming. Don't assume, just like you said, the person who answers the phone
Know what they talking about.
know what they're talking about, or know what changes has happened since the last time that phone call was made. My son called in 2022, the 30th of 2022, somewhere around then. He went to his appointment in 2023.
Change.
You know, a lot of things change between 22 and 23. So it might not even have been that the person didn't know what they were doing. They just didn't know. Now we're in 2023 and things have changed. And it happens just like, so here's what I'm telling you. These are your health dollars. He walked up in there, forgot to ask that question. They sat him nicely down, filled out his paperwork, took him in the back, spent $200, only to find out out of network. Time, energy, money. Can't even see the provider.
Did he get his money back?
What I tell you about stepping in their office? You step in the office and you pay. Okay? It doesn't matter that they're out of network. It doesn't matter. Yes.
I have a question. Is there ever a situation that you get your money back from the doctor's office?
Of course. Yes, sometimes. You can act crazy. You can act like you will not leave that office, and I'm just gonna sit here and scream and yell and act a crazy person, and just to get rid of you, you'll get your money back. If it's a copay and you're supposed to pay that amount, you won't get it back. If it's a deductible and you're supposed to pay, you will not get it back. If it is a copay and you were wrongly charged for it, for instance, most physicals you don't have to pay a copay for. That's one of the things that you will get away with the zero. And you may go in and they charge you your copay for a physical that's not supposed to be charged. When you come back, after talking with the insurance, you may find out they will give it to you back. They're supposed to, and that you should fight for. I found out I don't pay copays for PAPs, and I don't pay copay for physicals, and you charge me my copay $20 every time, okay? But the minute you step into that office and you engage the staff, your meter starts running. Even if you're in the wrong office, even if they're out of network. That's why for your dollar cents, do your homework. Call in advance. Talk to your insurance company, especially something like a PET scan or a body scan that's going to be over $4,000. You don't want that bill. You don't want these bills. Hospitals. You're in an emergency situation. 2 hospital choices. You know because you did your homework that going to hospital X, you don't pay anything. Go to hospital Y, you pay. What you want to tell that ambulance? You better not take me over to no X because I'm not paying. Right? You get your money back. If you can show that you requested, you asked for it in writing, and they charged you inappropriately, even though you directed them not to, you can fight and ask for the override for that. And you have to know about your dollars. You have to. But it's not your PCP's responsibility to know how your dollars flow. Okay? Our job is to be doctors, to tell you what to help you, your health with, who to see. But there are hundreds of insurance plans out. There's no way I'm going to keep in my brain all the plans, their deductibles, their copays, what their coverage, and know how to treat you.
And which patient is on what?
Oh, that's right, that each patient is one. So, find out before you take on a plan, do you cover my syringes? If you need transportation, there are a lot of plans that will pay for transportation. A lot of the HMOs pay for it. So pick up one that's going to pay transportation if that's something you need. I always say, if you need hearing aids, you know you've been saying, okay? And you know you need those hearing aids. In 23, you say, I'm going to get my hearing aids. Then you pick a plan that's going to cover hearing aids. But I'm going to warn you with the dentist. Most plans will cover some dental care. A cleaning, maybe partials. They're not going to cover them implants. Many of them won't cover implants. But you have to ask. And when you get to that doctor's office, if it's a general cleaning, don't get finagled into doing a deep cleaning.
And that's what they do.
Okay? Now tell me about your health dollars. Your plan says 2 cleanings a year. They're talking about regular cleanings. If they say, yeah, but I looked in your mouth, and you really, really need that deep cleaning. It's really just, it's a mess in there. I really need you to do this. In fact, I'm not even going to do a cleaning on you because you need a deep cleaning. You know what you do?
Next time.
That's right. You get up and say, I'm so sorry. At this point, I have only a budget for a regular cleaning because my insurance does it for free. Now,
Excuse me, we had hung on the 30th. When he went in January, he should have asked them some more questions.
Yes.
Because he didn't know that.
he did know because I told him to.
But he didn't do it.
Hey, look, knowledge doesn't mean execution. Okay? Many people have knowledge
But they
and do
don't
not
put it in
execute.
action, right?
which is called wisdom. Remember Dr. Powell told you that.
Yeah.
Knowledge is not wisdom. Wisdom is the execution of knowledge, and it's the perfect execution of knowledge. All right? It's the perfect execution. You know? So if I told you, call them, and you think to your brain, I already called them, I'm not doing that. And you walk up in there, and you don't ask. You know? My feelings were real hurt because medical professionals shouldn't do that. You know? But we're doing a lot of assumption. We're assuming doctors know who's on plans. We're assuming that plans don't change, that providers don't change. A lot of doctors are not on the same plans anymore. You could have been seeing a doctor for 10 years. In 2023, they're no longer on the plan that you chose. So before you pick your plan, confirm. Okay? And finally, the thing I want to go about with dollars. Food is really critical to your health. In fact, I would say above all, your food intake is one of the most important things. There is assistance out there for food. There's assistance, there's a lot of food drives. When you go to these drives, treat it like you care about your health. Take the things that you know are going to be good for you. The fruits, the vegetables. And because you can get a lot of these fruits and vegetables, buy some Ziploc bags, the freezer bags. Chop them up and freeze them. Okay? It will still have nutritional value. Of course, it's not the same as if you ate it straight when it was fresh, but it does have nutritional value. So when you get maybe bulk things, chop them up, freeze them. But don't put junk in, because junk in is junk out. You know? And I know that food has gone up. Eggs are $6 now. Okay? It's kind of crazy. It's still no reason to substitute junk. Okay? Do not substitute junk because prices have gone up. No matter how difficult it is. Always remember, this is the temple. This is my body vehicle. And yes, my health dollars has to go into keeping me healthy. So please spend your money wisely. Ask the questions. Ask them, ask them, ask them.
And you know, some of the plans, you can't get any junk with your food card. You get vegetables and fruits. No
They did
snacks,
that.
no cookies, no cake.
Oh, that's good.
I'm happy to hear that.
Yes.
Did you hear that? She said some of the food, the cards that you get with the insurance now won't let you buy junk.
No, you can't.
Yes.
I was gonna say too, like there's some fruits and vegetables that's in season, there's some that's
Seasonal.
not. And I feel
Beautiful.
like people sometimes will say, oh, this expensive, but the cheaper one is in season. The one you like is out of season, so it's gonna be more. Like me, I love cherries. Oh my god, I'm a cherry addict, but they're expensive. So I be looking out for when it's on sale. I can't buy them all the time, right? But I eat grapes until the cherries go on sale. You know, like I pick what's available on sale versus what I prefer. You know.
So we need to start making money decisions about our health wisely. That was a great recommendation Fran gave, which is find what is seasonal. When it's in season, it's a lot less expensive than if it's out of season, right? And get with friends. It is time for us to become a family again, where we do things together. You got a partner who has Costco card? You call everybody in the family, we're doing a Costco run, okay? We're doing a BJ run, we're doing a Sam's run, all right? Who wants chicken, who want meat, who want pasta, who want fruit? We're going to the Sam's run, and we're going to get bulk, and y'all come over, drop your coins on the table, and share. That's what we need to go back to be families. Because bulk buying is always less expensive than individual purchases. Become family-like again. It doesn't have to be blood. We got a group of friends here. Okay, who's doing the sand runs? Same thing with spending money on transportation. Hook up on the same day to the doctor. If you got the same doctor, get the same appointment day. And we all go together. We do a team, you know. They know all 10 of us coming. We're booking from 1 o'clock to 5 o'clock. Okay? And I bring the movie, so we'll watch a movie while everyone else is there inside. Okay?
I just feel like pay at the grocery store or pay at the ER. You pick.
So those are my recommendations. I gave also for, you guys had asked me before, so I just threw in for today. It's a 50 low sugar snacks. Most of them you'll find are vegetables and proteins. Sugar, I would say if it's white, it's not going to be right. White sugar, white flour, white pasta. You need things that have not been bleached of their nutrients. So get ready, bring a pen and paper. Next class, I'm going to be doing nutrition and health. And it's going to be big, so bring all your nutrition questions because this is really important, especially if it's time to get this body right. All right, guys? Thank you so much.